Hello, my name is Jones Muna. Today we are talking about Introduction to Nursing Medical Psychology. General objective. At the end of the lecture/discussion, students should gain knowledge and understanding of approaches/models in psychology and the importance of psychology in nursing. Specific objectives. At the end of the lesson, student should be able to define common terminologies used in psychology. Explain the approaches/models in psychology. State the importance of psychology in nursing. Introduction. Psychology is a discipline that focuses on the mental processes and behavior of human beings. It deals with various components of life issues such as learning, intelligence, emotions, perception, and environmental influences on individuals. Multiple disciplines use psychology in their day-to-day work. In nursing, psychology can be applied in clinical practice as well as education. Nurses are increasingly aware of the need to base their actions on a sound knowledge of scientific principles. Psychology is of interest to nurses because its subject matter is human behavior. Psychology. 1. Psychology is the science that deals with the mental process of both normal and abnormal and their effect on behavior. 2. A science of mental life, of its phenomena and of their conditions. Phenomena are such things as we call feelings, desires, cognitions, reasonings, decisions, and the like. Gross, 2010. 3. A branch of science that deals with the mind and mental process, especially in relation to human and animal behavior. Dorlands, 2007. Behavior. 1. The actions or reactions of a person or animal in response to external stimuli. 2. The way in which a person, organism, or group responds to a specific condition. Stimuli. 1. Something causing a response. 2. Something that has an impact or an effect on an organism so that its behavior is modified in a detectable way. Houghton, 2005. Theory. 1. A set of statements or a group of facts or phenomena, especially one that has been repeatedly tested or is widely accepted and can be used to make predictions about natural phenomena. 2. A set of facts, propositions, or principles analyzed in their relation to one another and used especially in science to explain phenomena. Phenomena. 1. Facts or occurrences that can be observed. 2. Something perceived or experienced, especially an object as it is apprehended by human senses, as opposed to an object as it intrinsically is in itself. Approaches in psychology. There are different areas of study that psychologists take and can be categorized into two approaches: the process and person. The process approach. This approach confines itself to laboratory experiments where animals are used with the assumption that they have similar physiology to human beings. This approach includes fields or branches such as the process approach, physiological psychology, a field dealing with the biological basis of overt behavior and mental processes or how the body functions can influence behavior. Cognitive psychology is a field that studies mental activities related to acquiring, storing, and using knowledge. It also deals with people's behavior and the motives for their actions. Comparative psychology. It is a field that focuses its studies on the similarities and differences between animals and human beings in their behavior, mental characteristics, and abilities. The person approach. It's a non-experiment approach where field studies are conducted on human beings. It covers areas such as social psychology. It focuses on the influence of social situations on the thoughts and actions of human beings and effect human beings have on one another. Developmental psychology. It is a branch of psychology that analyses maturation or growth and its effects on behavior. Human beings experience development in many aspects such as physical, social, intellectual, and emotional, and their behavior changes. Cross-culture psychology. It is a field that deals with the effects of culture on human behavior. Person approach. There are other aspects of applied psychology that are considered aspects of the personal approach are clinical psychology. The branch of psychology applies psychological principles to the prevention, diagnosis, and treatment of psychological disorders. Clinical psychologists are usually found in health institutions to provide psychotherapy. Counseling psychology. A branch that uses psychological principles to assist people or individuals dealing with their problems. Industrial/occupational psychology. A field of psychology that applies psychological knowledge and skills to work with the aim of improving organizational effectiveness and the quality of work. Education psychology. It is a branch of psychology dealing with the learning process of human beings, including the social, emotional, and cognitive processes needed for learning. It has a wide range of specialties such as special education, education technology, and curriculum development. Personality psychology. It is a branch that looks at factors contributing to differences in behavior and personal characteristics among individuals. Importance of psychology to nursing. Nurses in their day-to-day life deal with patients who may present with physical, mental, or social ailments. In order to provide effective nursing care, it is important to integrate the two disciplines. Psychology, being the study of behavior, helps nurses understand and accept patients as individuals with unique behaviors. Understanding and treating patients as individuals helps to create good interpersonal relationships. Understanding psychology as the study of the mind helps nurses to provide psychotherapy or refer patients with psychological related illnesses. Psychology helps nurse identify the patient's problems or needs, hence appropriate nursing measures are taken. E.g., a good nurse who communicates with her/his patients is able to identify pain, sadness, fear, anger in her patient by reading their verbal or non-verbal cues. Psychology helps nurse to assist patients with difficulties in coping with their illnesses and interact with others, especially where defense mechanisms are being used. A nurse as a frontline worker can use psychology to identify and diagnose mental and psychological distress. Helps nurses to understand their own behavior, thoughts, and feelings. It equips the nurse with knowledge of growth and development. It helps the tutors in nursing schools understand the psychological needs of the student. Thanks for listening and keep studying.